The Maryland Physician Health Program and its extraordinary staff saved my life. Despite prolonged efforts by myself, participation in 2 intensive outpatient treatment programs, and 2 different inpatient rehab stays, it was not until I signed a 5-year contract with and followed MPHP's individualized treatment program did I achieve continuous recovery from alcohol addiction. For many years, I had been aware of MPHP's extraordinary work and results. As a medical department chair at a major tertiary hospital in Maryland, I led the intervention for 2 physician specialists with alcohol or drug addiction. After successfully completing their programs with MPHP, both physicians have maintained long-term sobriety and have flourished in their clinical practices and personal lives. In addition, I was aware of MPHP's financial and governing independence from the Maryland Board of Physicians. It was because MPHP was confidential, private, and financially independent that I choose to self-report myself to MPHP and sign for a 5-year contract with them. After self-reporting, I clearly remember my first 2-hour in-person meeting. During that meeting, the staff was kind, non-judgmental, and thorough. At the end of that first meeting, I signed a 5-year contract knowing full well that if I did not follow their detailed, thorough, multidisciplinary program and tested positive for any of the random drug and alcohol screens, it would immediately impact my ability to continue my clinical practice. It was clear to me that MPHP's staff cared about me and was dedicated to my long-term sobriety, as well as my return to an active, robust clinical practice. During my first months of participation with the MPHP, I learned firsthand that their staff was excellent, very experienced, and extremely knowledgeable about and dedicated to treatment of healthcare professionals with alcohol and drug dependence, as well as behavioral issues that impacted their ability to practice. When I previously left a premier inpatient rehab program, I was given a comprehensive treatment program to follow. It's important to point out that the treatment program MPHP set up for me contained all the specifics of that inpatient rehab program and added even more specifics to it. Most importantly, the program added a centralized, coordinating, directing captain of a ship, an individual clinical case manager. My clinical case manager, along with the entire MPHP team that received information and reports about all the aspects of my recovery program, ensured that all the aspects were being followed and added direct communication with my hospital workplace and the hospital's physician health committee. And most importantly, MPHP's program added random alcohol and drug screenings. The immediate start of random alcohol and drug screenings was an invaluable component of MPHP's program. In addition to random urine screenings, MPHP added SoberLink to my sobriety monitoring. SoberLink is a handheld breathalyzer device that uses facial recognition. I received random text messages throughout every day of the week and was required to provide an acceptable breath sample in the device within an hour. If any test was positive or not provided within the allowed time window, MPHP staff would be notified immediately. It was critical to understand that if I tested positive, my workplace would be notified. Again, for my recovery, this was an essential element. I'm forever grateful and have great admiration for MPHP. I enjoyed years of medical practice in my specialty while providing the highest level of patient care in my career. I'm living a well-rounded life to the fullest. My relationship with my wife, 2 sons, family, and closest friends are thriving. This past year, I celebrated 10 years of uninterrupted sobriety.